morning. Welcome back to Open Med School. Today I am going to discuss how to do general examination in a patient with a gastrointestinal problem. This will be done in a stepwise fashion. You introduce yourself after washing your hands. The initial steps can be remembered by using a small tip wipe. A chaperone should be offered, especially when you are examining young patients and also a patient from different gender. The tip wipe stands for W for washing, I for introducing yourself and giving information to the patient, P stands for the proper positioning or repositioning of the patient, E is for adequate exposure without interfering with the dignity of the patient. Now you begin a general inspection of the patient from the side of the bed and also from the foot end of the patient, especially looking for whether the patient is comfortable at rest, whether they are tachypneic, any obvious equipments are attached to the patient, and any medications around. A patient with dyspnea in a gastrointestinal system disease signifies either the presence of ascites or the patient may be having a right-sided pleural effusion as a part of the cirrhosis, or it can be due to hepatopulmonary syndrome. So it is important to appreciate whether the patient is well, dyspneic, or in distress. The level of consciousness should also be assessed because in a case of cirrhosis, patient can have hepatic encephalopathy and there may be alteration in the level of sensorium. As mentioned earlier, look into the medications around like oxygen, any other attachments are there that should also be looked into, and look into the nutritional status of the patient. Build and nutrition is important. See whether the patient is cachexic as shown here. A body mass index should be assessed and a waist hip circumference also. In a patient with cirrhosis, BMI calculation is not very significant because ascites will interfere with the calculation of BMI. Now you go to examination of the hands. Most patients expect that you will be examining from the hands. Even though we are describing as general examination in a particular format, that is no pallor, cyanosis, clubbing, but the examination is better conducted in a stepwise fashion starting from the hands. In the hands, look for koilonychia, leukonychia. Here you can see that the nails are white in color. This is seen in hypoproteinemia, especially hypoalbuminemia, and it is seen in cirrhosis. Look for clubbing of the nails, which is a feature of, in a gastrointestinal case, it can be due to cirrhosis, inflammatory bowel disease like ulcerative colitis and Crohn's disease, or malabsorption syndrome like celiac disease. Look for Palmer erythema, which is seen in hyperestrogenism of cirrhosis. Look for tobacco staining and deputinous contracture. So clubbing should be looked for. Examine the hands tangentially and then look for the Shamrose window test. Obliteration of this diamond-shaped space is seen in clubbing. Now turn the hands. See whether the hands are pale. If the creases are having the same color of the palm, that indicates significant anemia and hemoglobin is usually less than 8 grams. Here you can see the hands are very pale. And pallor in a case of GAT disease may be due to blood loss, as from upper GI bleed, or may be due to hematochezia, or it can be due to nutritional causes. So there are different causes for anemia, and so it should be looked for. And the palm may be showing features of icterus, that also should be noted. Then another important finding that you can see is deputerinous contracture. This has got very different causes, but in a patient with cirrhosis, this suggests alcoholic liver disease. It is due to contracture of the palmar aponeurosis. It usually starts in the little and ring finger. And you can see here there is a two fingers, there is a fixed deformity is there because of the contracture of the palmar aponeurosis. Always remember to elicit flapping tremor. Ask the patient to hold the hands in front of you and look for features of a tremor. Tremor may be due to anxiety, it may be due to alcohol withdrawal state. Then ask the patient to keep the wrists extended, the hands upwards towards the ceiling, keeping the fingers extended, and you can sometimes see flapping tremor. Flapping tremor is a negative myoclonus, and it is due to inability of the patient to keep the hands in a sustained posture. So it is the inability of the hands to maintain in a sustained posture. This is a feature of cirrhosis. This can be seen in not only in liver disease but also in COPD cases, patient with renal failure, drugs like sodium valproate, and many neurological disease also. Examine the hands for scratch mark. This can be seen in obstructive jaundice. Now it is time to assess the pulse. Look for the pulse. Then, pretending that you are counting the pulse, take the respiratory rate. Check the SpO2, record the blood pressure and temperature. So, vitals should be recorded. Now, look at the face. We are mainly looking at the eyes, one for the conjunctival pallor. This is the way with both hands you expose the palpebral conjunctiva and see whether it is pale, where there is congestion is there. Along with it, you can look for jaundice. So here you can see yellowish discoloration. Ask the patient to look down, and again in the same way look for in the bulbar conjunctiva and sclera also look for the yellowish discoloration. In the eyes, in a patient with GIT disease, especially cirrhosis, look for the presence of KF ring. KF ring is having a golden brown color, and it can be differentiated from arcus senilis. In arcus senilis, it is a white in color. There is a clear space between the ring and the sclerocorneal junction. Here you can see there is a ring is there, that there is a clear margin from the sclerocorneal junction. Here the ring is continuous with the sclerocorneal junction. There is no separate spaces there. And if you use a slit lamp, this will be in the deposition is in the Descemet's membrane. Copper is deposited in the Descemet's membrane. That is how you differentiate it. That is by looking at the color, clear space between the limbus and the ring, and also the slit lamp examination in which layer the deposition is seen. Now look at the face. Ask the patient to open the mouth. Look at the angle of mouth to angular stomatitis. Look for pigmentation, pallor, jaundice. In addition, the side of the tongue, look for oral hairy leukoplakia and also oral thrush. The oral hairy leukoplakia is differentiated from thrush. When you are scraping, it cannot be removed. And after ulcers may be seen, which can be seen in Crohn's disease, ulcerative colitis, Behçet's syndrome. So it is important to examine the mouth and oral cavity as part of the general examination of the gastrointestinal system. Now you look at the neck. In the neck, we are mainly interested in the lymphadenopathy, especially the left supraclavicular lymph node. If it is enlarged, it is called the Virchow's node, and the sign is called Rosier's sign. So look for Specifically look at the left supraclavicular lymph node, and the presence of it suggests infradiaphragmatic malignancy, especially carcinoma stomach. Now examine the chest. We are mainly interested in two findings. One is looking for this spider angioma. It is a central arteriole which is dividing and forming a spider-like appearance. By using a glass slide, you can press on it and you will see that it will blanch. Don't use a sharp object to press because this may produce injury and produce significant bleeding. Second finding you should look for is the gynecomastia. So it is not the fat tissue, but you palpate with your fingers and see whether the breast tissue is enlarged. Examine the axilla and also chest and see whether there is any hair loss or feminine distribution of the hair. A general observation of abnormalities on the abdomen should also be made as part of general examination of abdomen. So look for caput medusa. You can see dilated veins going around the umbilicus. There can be an abdominal distension. The feminine distribution of hair or hair loss may be there. And look at the inguinal region, and a testicular atrophy can also be examined. Now you look at the legs, especially looking for dependent edema. Press above a bony point for 30 seconds and then palpate and see whether there is any dependent edema. Dependent edema in a patient with liver disease suggests cirrhosis. Or it may be due to hyperproteinemia, or patient can have other conditions. So looking for edema is very important. So when doing a general examination of a patient with liver disease, keep in mind what are the stigmas of liver disease. So effects of liver cell failure can be patient can alter level of sensorium, scleral icterus, fetal hepaticus, spider nevi, gynecomastia, jaundice, loss of sexual hair, liver flap or hepatic flap, bleeding tendencies, anemia, testicular atrophy, and angle edema. So these are important and they should be examined as part of the general examination. Other findings you can see is the history you may get hematemesis, can be melena. On examination there can be hepatic splenomegaly, caput medusa, ascites, and hemorrhoids can also be there. So during a proper general examination, we will get an idea regarding what is the underlying pathology and specifically look for stigmas of liver disease. I request you to watch the video lectures on history taking part 1 and part 2 of Open Med School before going into the details of gastrointestinal examination. If you like this channel, don't forget to subscribe.
Doctors talk on various topics. Stay tuned for